102.9 DRC-FM. It's Saturday morning on the Big D. This is Jerry Kristafer, and in our spotlight this morning, joining us from Bristol Hospital is physical therapist in the Rehab Dynamics Center is Jared Parker. Jared, how are you this morning?
I'm doing very well.
Good to have you here. You know, we had a little snowfall the other day. We're into December, and that can only mean one thing besides holiday shopping. It means winter sports accidents, and I would imagine that keeps you pretty busy there at Bristol Hospital.
Yes, it sure does. Yeah, definitely.
Now, what kind of things do we see this time of year that would probably not be something you'd have to treat other times of the year?
Well, we certainly see a lot of various orthopedic injuries throughout the year. More commonly in winter, we start to see a lot of the fall-related injuries. Some of those include fractures to the elbow, wrist, or hand, as well as various sort of sprains and strains throughout the lower body, knee, ankle, foot type situations.
So this is like ice skating, playing hockey, it's going skiing, snowboarding, or just slips and falls, things like that.
Exactly. Yeah, sledding as well, another sort of activity that maybe you don't think of, but also one that can potentially cause injury.
Now, talking about ice skating and things like that, is that a muscle group that we normally don't use like the rest of the year, and then once we try to ice skate for the first couple of times during the season, we wonder, where those muscles went, and that causes strains and things like that?
It can, yeah. Any seasonal specific activity requires different muscle groups to perform, and like you said, if you haven't been doing any type of activities throughout the year to mimic that, you are certainly going to be more susceptible to sustaining an injury.
So do you see, let's say we have Mount Southington is close to Bristol. Do you see a lot of people coming in that thought they were, what are they called, hot dogs on the ski slopes? They think they know it all, and they put the skis on, and all of a sudden they realize they don't know as much as what they thought, and they've got an injury that you have to treat.
Yeah, we see that. I think one of another issue that goes along with that is people end up getting fatigued. Like we said, you start an activity that you haven't done throughout the course of a year, and those muscles just aren't ready to perform the way you need them to. So you can end up, again, suffering a sprain or a strain in those particular grooves.
So now, Jared, how do you prevent those from happening then?
The most important thing to do really is never exercise essentially or perform the winter sport activity cold. Try and perform a pretty general type of warm-up activity prior to engaging in anything, again, like skiing or snowboarding or ice skating. And that can include simple things like some dynamic stretching or jumping jacks, some jogging in place. I mean, it doesn't have to be anything very advanced or specific, but just to get your body loose and your muscles warm, really make a difference.
Stretch the muscles and get warmed up, right?
Absolutely.
What's one of the worst things that could happen to somebody out there on the ski slopes or sledding or ice skating that you see come through Bristol Hospital in your Rehab Dynamic Center there?
We kind of break it down into two things. I mean, you can certainly sustain various orthopedic injuries like we've been talking about, strains, sprains, fractures, but even more sort of potentially dangerous is a head injury. Usually any type of fall or making contact with an object or another person that was unintended can sustain an injury like that, and certainly the best way to prevent that would be to wear a proper helmet.
Skiing, ice skating, anything where
sledding, yeah,
right?
Correct. Yep.
Okay. It's Saturday morning. What do you do on Saturdays?
Most times I spend the day with the little ones. I got two little kids at home, so.
How old are they?
I have a son who is 3 and a daughter who's 18 months.
Oh, boy. Well, we get a lot of snow. I know what Jared's going to be doing.
I'll be sledding.
You'll be sledding and making snowmen,
That's
right? Or snow women, snow people.
There you go.
Jared Parker, physical therapist at the Rehab Dynamics of Bristol Hospital. Thanks for talking with us here this morning.
Thanks for having me on. It's
All
my
right.
pleasure.
Take care.
You too.